Hello, friends. Mike Collins here, Healthway Compounding Pharmacy. I am the owner and pharmacist at Healthway in Saginaw, Michigan, and I'm very lucky today to have Dr. Tim Dailey with me this morning. How you doing, Dr. Dailey?
I'm great, doing great.
Doing super. Well,
Good
that's
day.
great. Well, Dr. Dailey is a doctor of podiatric medicine. We call them podiatrists. You might know them as foot doctors. They have a lot of different types of terminology. And so, Dr. Dailey, tell our friends a little bit about what is a podiatrist, and talk about that whole field of medicine.
Yeah, well, podiatrist or foot doctor or foot and ankle specialist, someone who treats feet and ankles. And each of us, we can be slightly specialized in the different things that we do, but basically any foot or ankle problem, a podiatrist is usually capable of handling those things. So anything from an ingrown toenail to warts to heel pain, or the weekend warrior, the sports injuries. Usually those are things that we can handle in our office, and anything from conservative care to surgical intervention. So it's a well-rounded thing, but there's so much with the foot and ankle that goes on that can cause pain, and so we try and keep people doing the things that they enjoy to do.
Awesome. So I know some podiatrists do surgical interventions and do some surgeries. Tell us a little bit about how do you practice surgically and what kind of things would you happen to do?
Yeah, so most of the things can be treated actually non-surgically. So I do a lot of conservative care, so being strapping and taping and things like that for pain or injections or removing ingrown toenails. Those are things that can be done in the office. I do not do as much surgical intervention, but if that's something that we need at a certain point in time, we have people around here that do a lot of that, and we can refer to them as well.
Awesome. So patients, can they just make an appointment with you? Do they have to have a referral from their family physician? How does that work?
Yeah, these are all good questions. So usually a patient can just call our office. So you don't usually need a referral. There are certain insurances that will require a referral. But really, if you call the office and ask us and we figure out the insurance, we can let you know whether you need that referral. But you can just call without going through your family physician.
Cool. So tell us a little bit about how you got here to this place in Freeland.
Yeah, so the short version of the story. So, of course, I grew up here in Michigan, and I did my residency out in California. We moved back. I used to practice up in Clare with another physician, and an opportunity opened up here in Freeland, and I live in Midland. We've lived there since we moved back, and I just enjoy the area, so I took over an office here in Freeland, which is a great community. The people are great, and the
Super.
surrounding area is just all around really good people.
Cool. So what's your physical address and phone number? How else could they get a hold of you?
So you can get a hold of us by calling us, which phone number is 989-695-6788, or you can stop into our office. It's 7305 Midland Road, or Suite 2 in Freeland, Michigan. You can also check us out on our Facebook page, which is freelandfoot.com,
Excellent.
or check us out on Facebook.
Super. Well, all that good stuff is going to be typed up down here because I've got a super guy, Eddie, my other pharmacist, who loves to do all this techie kind of stuff. So hopefully all that stuff will show up and you people will be able to see that. So thank you, Dr. Dailey, for spending time with us today, and check us out and some of the other videos that we're going to create in the future. Thank you.